Good afternoon, everybody. It's Dr. Galvin with today's coronavirus update. Today is Wednesday, April 29th, and we are now, 2 months into this crisis. We'll run the numbers quickly, and then we'll cover a few other topics. 3.2 million cases worldwide, 225,000 deaths, 960,000 recoveries so far. Here in the U.S., we've crossed 1 million, 1.06 million cases, 61,000 deaths, 123,000 recoveries. Here in my little neck of woods in North Carolina, we're up to 10,000 cases, 354 deaths. 61,000 deaths in the U.S. That's an interesting number because we think that the annual rate of flu deaths, depending on the flu season, and this season's actually been a fairly bad flu season. I think the estimates are around 55,000 deaths from the flu this year. But typically flu deaths are between about 24,000 and about 65,000 a year. And so we've had, 50,000 flu deaths, but we've also had now 61,000 deaths from COVID-19. So we can see that in 2 months we've had almost as many flu deaths as we had during the entire year. Now there's some good news. The FDA has granted emergency use for remdesivir because of some preliminary encouraging results that it may reduce the time of recovery for seriously ill patients with COVID-19. And also vaccine research is accelerating worldwide, and Oxford University in England has apparently a vaccine candidate that they think may be usable by September. Now this is very preliminary, safety data needs to be done and everything else. We've talked a lot about, there's all these competing voices on the news about this and that and death rates and everything else. And one thing that does get brought up occasionally is that Sweden has gone a different way than the rest of the world. And Sweden has decided to not lock their society down, but instead implement social distancing but not close things. So they're limiting numbers of people in restaurants and bars, they're limiting gatherings to less than 50 people, but they're really not locking down, they're not closing businesses. So what has been their experience? Well, I looked at the death rates in Sweden versus its surrounding countries. And Sweden, if just a geography lesson, is bounded by Denmark, Norway, and Finland are all right there. And then there's the Baltic Sea, and there's some other countries that border it. So if we look at all the countries around it, Denmark has 7 deaths from COVID per 100,000 people. Norway and Finland both have 4 deaths per 100,000 people. Estonia has 4 deaths, Latvia 0.7 deaths per 100,000, Lithuania 1.5 deaths per 100,000, Germany 7.6 deaths per 100,000, and Poland 1.6 deaths per 100,000 rather. Those are all countries that are within spitting distance basically of Sweden. Sweden's rate is 22 deaths per 100,000, so significantly higher. So does that mean that they're doing the wrong thing? Well, maybe not, because if you think about it, we don't have any immunity to this disease, and the virus is very contagious. So we've got the problem with a highly contagious virus that we have no natural immunity to, but also we're learning is that your risk if you're young and healthy is extremely low, so extremely low mortality. And we also know that can be shed by asymptomatic people. So locking down societies is an important way of combating this when we don't have a lot of information. But now that we're gathering more information, Sweden may well be a model to look to, because they've done an antibody study there and they found about 11% of the population has antibodies against the virus. And we've talked a lot about antibody testing, and it's still unclear. You need to know what kind of test they use. We don't know that. But about half the deaths in that country are from the capital of Stockholm, and the rates of positive levels in Stockholm is actually a lot higher. I don't know exactly, I've read a couple different things, but they range up to about 50%, and we need to hit 70% for immunity. So, those 22 deaths per 100,000 are probably people that were going to die anyway. Because again, the virus can't be contained. No matter what we do, it's very, very virulent. It's very contagious. So has Sweden essentially gone and taken their numbers of deaths up front and hoping to get to herd immunity quicker and doing so without destroying their economy. And that may be a way forward for us. Now, I'm not an expert on any of this stuff, but I am a practicing emergency physician. I don't want to see people die unnecessarily, but the logic of, locking things down was really to kind of keep from overwhelming the hospital systems and overwhelming systems. And the fact of the matter is that, probably 100,000 or many more are going to die in this country, but is locking them down going to change that number? No, it probably isn't, because those risky populations, those people that are older, that have obesity, that have hypertension, that have diabetes, those populations are going to be at risk, and those are the ones that the majority of the deaths are going to come from. 80% of our deaths are folks that are above 70 years old. So maybe there's a pathway for releasing restrictions on younger folks, because your risk of dying from this is infinitesimally low if you don't have any risk factors and you're less than 45. You're a little bit higher risk between about 45 and 65, but maybe twice the risk. But again, relatively reasonable. So there may be a possibility for us releasing some restrictions, letting non-essential people go back to work, maintaining social distancing, wearing masks out in public, while at the same time kind of keeping restrictions on those people who are at high risk, that have those underlying medical problems and who are older, to try to protect them, and then very aggressively test, both antibody testing and COVID testing, to find out where hotspots are, because we may need to lock those hotspots down if things start getting out of control. And the other thing we need to very aggressively do is quarantine those people that have the virus. So if you get diagnosed with it, we've got to have some system in place where we can lock those people down and say, listen, you're contagious for 2 weeks, you can't go out, and effectively contact trace, find out who those people were, and in doing so, find out who's at risk and potentially have to quarantine those people. But by doing that, we may be able to open up the economy much quicker, understanding that we're going to still have a lot of deaths, but we are just slowing the rate of those deaths down. We're not really preventing them by quarantining. And if you think about the death and destruction that's being caused by quarantine itself, that's significant as well. We know huge rates of domestic abuse, of child abuse, people losing their livelihood is just as dangerous in many cases as this virus. So again, a possible way forward by releasing some of the restrictions, identifying the people who are at lowest risk, let those people go back to work, test and quarantine and contact trace those people that come down with it, and have a very short leash to pull things back if we have big outbreaks like in New York. Again, just the opinion of a humble emergency doctor who, may or may not know what I'm talking about, but I agree that we need to get back. We need to have good data. And along the words of data, just on a lighter note, one of my good friends, John Brock, who apparently watches the video, and they have a drinking game based on how many times I will use the word data. So John, this is for you. Data, 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 data. Anyway, something to think about. I'll be back tomorrow with another broadcast. I do think we'll do a Facebook Live later in the week. I am kind of thinking maybe we'll do it on Friday, although keep an eye on our page. I might do it even tomorrow afternoon. Have a great night. We'll talk to you later. As usual, wash your hands, take care of yourselves, take care of your families, take care of those around you. If you like this, please follow us on Facebook, subscribe to our YouTube page, and hit the little bell so you get updates when we post. Have a great night.